BMA's current position on presumed consent is that we're in favour of what we call a soft system, which is a system where the law says we can take the organs from someone who hasn't chosen to opt out of giving organs, but we always give their family the opportunity to say that they might have changed their mind and therefore to override, as it were, their lack of an opt-out.
It's gone backwards and forwards over the years. Why does it keep coming up?
It keeps coming up because people are very concerned about getting it right. We have a very successful organ transplant system in the United Kingdom. The only unsuccessful thing about it is that we have people dying on the transplant waiting list because we don't have enough organs. And although the numbers are going up, we're getting better at retrieving organs, we still don't have enough. So really it's about what will be the best way to get the maximum number of organs and to actually really give people an opportunity that once they go on that list, they can be pretty confident they'll get a transplant and their lives will be saved.
And is the central ethical problem for doctors about the way that patients are treated, the way the pressure that is put on patients, or the difficulties in practice?
I think that the central problem for doctors in the past has been the practical difficulties. We haven't had enough transplant coordinators, we don't have enough ITU beds or theatre time and so on. That continues to be a bit of a problem, although it's getting better. But we need at the same time to make sure that the system makes people feel that they are altruistically giving a gift and that they're not in any way being coerced. And we need to make sure that even with presumed consent, people are quite clear this is about a gift. It's just that they choose not to opt out of giving a gift rather than they choose to opt into giving a gift.
So what do you expect to be debated today?
I think we'll hear a number of doctors today in the debate talking about their concerns about how to maximise the numbers of organs, how to look at the evidence from different countries and how to see what will happen. Interestingly, with the Welsh Assembly government having said they're going to bring this system in, there may be people from the other countries saying that's great and let's see if it makes a difference in Wales before we legislate in the other countries.
The abortion limit is also another perennial and is coming up again at the ARM. What is the feeling now amongst doctors about the abortion limit?
The feeling amongst most doctors about the abortion limit remains, I think, that the current limit is right because the current limit reflects the reality of whether or not a baby born prematurely would be likely to survive. Really remarkable things have been achieved over the last 3 or 4 decades so that premature babies have a good chance of survival, but below 24 weeks the chances of survival are extraordinarily small, and literally the day-by-day number of days below 24 weeks makes a dramatic difference. Terminating pregnancies up to that limit, I think most people would say should remain, but we all accept that most women prefer to have their terminations much earlier. It's much easier. Those late terminations are usually for cases where there's been a late diagnosis of a very serious fetal abnormality.
It is an extraordinary subject for doctors though, in that you still have conscientious objection. How often is that coming up, and does it cause a crisis for the profession in terms of staffing this issue?
Generally speaking, there's no crisis for the profession in terms of staffing because most units have people with different views. I think it's important to say that just as no woman chooses to have a termination easily, doctors don't do this easily or readily. Most of the doctors performing terminations are, of course, obstetricians who spend most of their life doing everything they can to help women who desperately want children. But they also recognise that this is sometimes absolutely wrong for a woman at that time, and that's why they support the continuation of the current Abortion Act.
It causes great strength of feeling, of course, amongst the general public as well. That's something that doctors are very conscious of.
Doctors are very conscious of public feeling on this, and we accept that this is the sort of issue which should be and is decided by the public, usually through Parliament. It's not an issue for doctors to make the final decision on, but doctors can quite rightly have a view, and that view can be one which helps inform the public debate. So issues such as, are we talking about when babies can survive from? If that is an important issue, then clearly doctors and their technical knowledge becomes an important thing to express.
I know you're also going to be involved in the debate, the international debate about Bahrain doctors. Could you tell us a bit about your experience on that? Yes,
the BMA has been very involved in working on human rights really for about 30 years now. And one of the things that we are very aware of is that in some countries at the moment, and there are a number of these where it's happening, doctors who treat members of, say, a rebel group are being threatened, they're being arrested, and in some cases standing trial, almost as if they are complicit in the rebellion, when in fact what they're doing is obeying the Hippocratic Oath and treating anyone who needs medical care regardless of their political beliefs or anything else. And it's very important that governments understand this. So we need to make sure that the UK government not only understands this, but brings this to bear in their discussion with other governments, as well as writing to those other governments to say doctors around the world are required to treat anyone regardless of their politics or regardless of how they happen to be treated, and you mustn't arrest people and try them for carrying out what is a doctor's ethical obligation.
All of these subjects, the ethics, if you like, of medical practice, remain some of the most difficult areas for you to discuss at the BMA because you can't really legislate for people's opinions.
While we can't legislate for people's opinions, what we can and must do is have a common understanding of the bottom line. Ethics is about the bargain that we make with society. And it's important to be clear with society what that is, what the limits are, the rule that doctors will follow. That's the way you get public trust and confidence. The public know that we won't experiment on them without consent because we have an ethical code which the public understand. And it's very important that we have these debates about new issues, particularly issues which challenge existing ethics, because that can give the public confidence about what we're discussing and why, and how we're making sure that the interests of patients and that relationship of trust between patient and doctor is always protected.
Dr. Vivienne Nathanson, thank you very much.
Thank you.